We are launching a new series here at 4 o'clock on 9 News called Mental Health and Me. It's a topic that's always been important, but since the start of the COVID-19 pandemic, we are often reminded how important it is to take care of our mental health at a time where we may not have a lot of control over our lives. And to help us kick things off, who better than Dr. Max Wachtel joining us now. Hey, Dr. Max, how are you doing? It's been a while.
I'm doing all right. I'm broadcasting live from my basement. That's the reality of COVID, right?
Right, the new norm. All of us on all of the video conferencing methods. So we're talking today about coping with the stresses of the pandemic. Who do you think is doing well and who's not?
Yeah, so surprisingly, older adults are doing really well. This is something that was researched through the University of British Columbia recently. They surveyed a whole bunch of people, ages 18 to about 90 or so. What they found is that younger adults are really struggling with a lot of coronavirus-related stuff, things like working from home, online schooling, dealing with unemployment issues. Older adults are also dealing with coronavirus stressors, the different stressors though, things like higher rates of disease contraction, potential for severe complications, higher mortality rates. But older adults seem to be dealing with that stress a lot better than us younger adults are.
And that's interesting because when you think about younger populations, you think about how connected they are to the internet, as if it may be easier to stay connected with the people that they love and care about. But maybe this shows that there is need for human interaction, to see someone person to person and look them in the eye and have a conversation.
There is that real need. It's incredibly important to do that. And that's where the older adults really come out to shine here, that they're finding a lot of really positive daily interactions with other people. And that is helping them out quite a bit. Now, what the study didn't look at are those older adults who are stuck in nursing homes or assisted care facilities where they are isolated and feeling a lot of stress and depression and anxiety from that. But older adults aren't spending time on Facebook and Twitter in the same way that younger adults are, and that is just so much better for their mental health.
Of course, there's not a catch-all advice given the differences in generations and ages, but what advice can you give to folks, maybe younger folks and older folks? Is it different?
With older adults, keep doing what you're doing. If you're in an assisted living facility, you really need to learn how to Skype or Zoom or use Google Meets or whatever it is. That you really need to have that interaction. For younger adults, you got to get those positive interactions in other ways. Get off Facebook and Twitter. The best advice, though, talk to your grandparents, talk to your parents, and figure out what they're doing. They're older, they're wiser, they have a lot of coping skills, and we can draw on that experience.
Yeah, and I think, the silver lining of this pandemic, Dr. Max, is that there is an end in sight. There's a vaccine in sight, hopefully sooner rather than later. And young people should certainly keep that in perspective as we look toward the future, because I think so many are feeling isolated. They're stuck at home right now. The most interaction that some of them are getting is, in Zoom classrooms right now. So I guess what I'm saying is there's a reason to look forward too.
There is some hope. We've got that vaccine coming. We don't know when it's going to be here, but we know that this is going to end. You're exactly right. And then we also just have to know that there are some things that we have to deal with and that we can't change right now. The working from home, the unemployment stressors, the online schooling. Those are just issues that we have to deal with now. And they're temporary.
Yeah, just some things that are out of our control for now. Hey, Dr. Max,
Absolutely.
Good to see you. Thanks for joining us on this new segment. We hope you're back with us again soon on it.
Yeah, this sounds like a great segment. I'm really excited about it.
All right, take care. Have a good Monday.